Hi there, I'm Dr. Audrey, board-certified and fellowship-trained refractive and cataract surgeon, ophthalmologist, and cornea specialist. And today, I'm here to talk about the dangers that certain cosmetics pose to your eyes and give you my 5 top tips on how to safely apply makeup and cosmetics around the delicate area of your eyelids and eyelashes. Let's ensure your beauty routine is as safe as it is stunning. Many people don't think about their facial cosmetics very often, but if putting on eye makeup is part of your daily ritual, it is important to learn about eyelid and eyelash cosmetics because your eyes are the most important and delicate sensory organs you have, and the area around the eye contains some of the most sensitive skin on the whole body. Okay, let's get right into it with my top 5 tips to keep your eyes safe while embracing the beauty of eyelids and eyelash makeup. And remember, if you have any eye conditions or questions about your eye makeup routine, always ask your eye doctor. Tip number 1, be cautious with glitter eye makeup. Be careful with metallic glitters, sparkle powder, or face paint. Flakes can fall into the eye, get into the tear film, and irritate your eyes. Glitter eye makeup is also a common cause of corneal abrasion or infection, especially in people who wear contact lenses. Large glitter or inclusions in makeup can scratch the eye, much like getting sand or dirt in your eyes. When using face paint, make sure to avoid the lash line. Which brings me to tip number 2. Always apply makeup outside the lash line, away from the eye, to avoid blocking the oil glands of the upper or lower eyelid. There are specialized glands on the eyelids near the lashes that secrete oil that protects the eye surface. So to make sure you don't clog the oil glands or accidentally apply any makeup directly on the eye, always apply cosmetics outside of the lash line, away from the eye. My 3rd tip for you today is about eyelashes, specifically those of you who are interested in faux eyelashes or eyelash extensions. Eyelash extensions can be done safely if applied by a professional. Most of eyelash extensions are placed using tweezers and a specifically formulated semi-permanent glue. There are also magnetic eyelashes, which are applied with an eyeliner with tiny magnetic particles in it. Both magnetic and glued lashes can irritate the sensitive skin around the eyes or dip into the eye and scratch the cornea if not applied well. To reduce the likelihood of these possible complications, avoid false lashes entirely or wear them for special occasions only, and make sure to have a professional do it. If you experience any discomfort, see an ophthalmologist right away. My 4th tip is something a few of my patients have asked about, which is always be careful when using Latisse. Latisse is an FDA-approved prescription eyelash enhancer. It's applied to the lash line to promote the growth of longer, thicker eyelashes. Latisse is the brand name of bimatoprost ophthalmic solution. This same drug was first used as a treatment for glaucoma called Lumigan. And some people using Lumigan for glaucoma notice that their eyelashes become longer and more lush. Sounds good, right? But what are the side effects of Latisse? There are some possible side effects to watch out, which is why it is only available by prescription. Possible side effects from using Latisse can include red eyes, dry eyes, eyelid irritation and itchiness, and darkening of eyelid skin, all of which usually go away when you stop using Latisse. Another side effect from using Latisse is that your iris, the color part of your eye, can actually become darker by developing more brown pigment. If this occurs, it is usually permanent. To lower the risk of side effects from Latisse, closely follow your eye doctor or pharmacist's instructions. And if you wear contact lenses, always take them out before using Latisse, and wait at least 15 minutes before putting your contact lenses back in your eyes. Also, never reuse the single-use applicator for this drug, and do not let the bottle tip touch your eyeball or another surface, like a counter or sink. You may have seen non-prescription beauty products for eyelash growth being sold in stores, but I would avoid these as they're not FDA approved, probably do not work, and at worst, they may not be safe for your eyes. And finally, tip number 5 is avoid heated eyelash coolers. So you have all seen those heated eyelash coolers on Sephora or at the department store that are either battery powered or plug into a USB charger. I know they advertise that the heated coolers can help provide an extra long-lasting lift compared to the mechanical ones. What you may not know is that they can be quite dangerous to your eyes. Your skin burns at about 118 degrees Fahrenheit, and sustains second-degree burns at about 131 degrees. But the skin of the eyelids is especially thin and it can be burned at an even lower temperature. Heated lash colors often range from 100 degrees to 150 degrees, sometimes even 200 degrees Fahrenheit. So if you accidentally touch the heated lash color to anything, that much heat around the eye can cause lashes to fall out, burn your eyelids or the skin around the eye, or cause serious burns to the white part of your eye or your cornea, the clear windshield of your eyes. If there are burns to the middle of the cornea where you see out of, they can cause scarring and permanent vision loss. I would recommend not using heated eyelash curlers at all, but if you absolutely still want to use a heated eyelash curler, here are some safety tips to keep in mind. Check the exact temperature of each setting and to start with the lowest temperature possible. Be careful not to pull too hard on the lashes. Do not repeatedly go over the same area multiple times. This can cause heat damage. And of course, if you're unsure if a product or device is right for you, always talk to your ophthalmologist first. Well, that's it for my top 5 tips for safely applying makeup and cosmetics around the eyelids and eyelashes. I hope you found this video helpful, and if you have learned anything new, please consider hitting the like button and subscribing to my channel to support more informative content on eye health and surgery. You can also follow me on Facebook, Instagram, and LinkedIn at Dr. Audrey Tai to learn more about my practice. Thank you again for watching, and I'll see you in my next video.